Dr. Richards, thank you very much for being with us, Voices from Oxford, the University of Oxford. I was very impressed with the number of students who turned up today. It's beautiful weather, as you can see, and this is a Sunday. What attracted them today? And could you tell me why practical skills and simulation are so important?
It's about the modern NHS, all about competency-based training, and the students are brought into labs to teach them policies and procedures, which is not easily done in a clinical sort of setting. They get familiar with the kit, the equipment. We use simulation, sort of body parts, or high fidelity simulation, going on to sort of very sophisticated equipment that's used. But actually, ultimately, it is about whoever's delivering the teaching. And certainly Oxford Medical School makes a lot of use of peer teaching. So these are the first clinical year medical students. They are taught by final year medical students, introduced into the whole sort of system, the world of medicine, and some of the junior doctors are involved, and it works for the benefit of everybody, because not only are the students benefiting from it, but the teaching students learn more by actually teaching.
Yeah, you are absolutely right. Actually, teaching is learning.
It is so much part of learning.
Yeah. And also lots of students were giggling, and they really enjoyed themselves.
I know.
Yeah, I hope junior doctors who were involved also enjoyed themselves.
I think they do. Yeah. It's very beneficial, I think, for the health service as a whole to have the understanding that we look after each other. Even from a very junior level, starting to look after each other and help each other out, and also familiar faces in very sort of stressful environments sometimes when they, when the students walk in and they recognise some of the junior doctors. I think it's a really good experience.
Yeah. Did you have this kind of session when you were a medical student?
No, not at all. No. All of our teaching was delivered by much more senior people, that much further removed from actual feelings and and worries and of the junior doctor or the student even. So I think this is absolutely brilliant, and they really engage here. They've also set up the junior doctors here have set up a fantastic way for people to integrate. So tutorials are advertised on a website, and then anybody who wants to teach can feed into that. So whatever they want to teach, they can put up there, the students can sign up, and vice versa, which is a really good way of getting them to integrate.
So actually this system is really desirable because anytime, anywhere, interactive.
Yes, whatever
That's
anybody
wonderful.
wants, they can put up there, and somebody else will respond on the website, which is called TuteMate.
Okay. My another question is, has technology helped you teach?
Oh yes, I mean it's all technology. I mean the whole world out there making simulated models for medical education is vast. All over the world they're making beautiful pieces of kit, more and more looking like the real thing. So that's the one part of technology. Obviously then there's the web-based stuff with the sign-ups, and getting people to either decide who teach who and so on. So simulation, high fidelity simulation, uses a lot of technology because it's computerized driven models that we use. Well, at the end of the day, I think it's the interaction of the humans that makes the difference. These are just pieces of kit that bring us together.
Right, you are the head of clinical skills at the University of Oxford. Could you tell us your views on junior doctors teaching, please?
It's a very, very beneficial system because we get interaction, because we have senior people like myself. We have practice development nurses who are more often than not the people who would be deciding on the policies. And then we have the junior doctors coming in, not only delivering those policies and procedures to their juniors, but also learning from it. So you're sort of catching 2 layers of people, or 2-3 layers of people, all with interaction.
Dr. Richards, thank you very much for being with us.
Okay, it's a pleasure.